to the gentlelady from the Virgin Islands, Delegate Representative Christensen.
And thank you for yielding. And repealing the Affordable Care Act is going to cost this country exponentially in the years to come. And so they're doing the exact opposite of balancing the budget in the long run. But, you know, I have to ask the question, just how much more austerity can the American people take and still survive? The recession, which is struggling to recover, has been bad enough. But with past cuts, the sequester, the CR, and now the Republican 20 budget, they're threatening to make a bad situation even worse. I want to focus on just the hits that healthcare has taken. From Rosa DeLauro's report, we learned that since 2002, labor, health, and education programs have endured cuts of 7%, resulting in a nearly $12 billion reduction in funding in 2012. Going forward, the discretionary budget caps set in the Budget Control Act of 2011 are estimated to cut over $9 billion, or 5.4%, in 2021. Altogether, this will result in a 12% per capita cut, or a nearly $22 billion cut to labor, health, and education programs in 2021 when compared to the 2002 levels. These cuts will weaken these critical programs that protect the public health and safety, promote and develop our workforce, and educate the next generation of Americans. If we just look at programs under the Department of Health and Human Services, here's a partial list compared to 2002 levels in 2012. In 2012, Health Resources and Services Administration has seen a $2 billion reduction, which includes a $194 million reduction to the program which provides critical funding to support training new health professionals. The Centers for Disease Control and Prevention has had a $122 million reduction. The National Institutes of Health, a $1.2 billion reduction from 2002 levels. And the Substance Abuse and Mental Health Services Administration has seen an $813.3 million reduction. All of these reductions, all of these cuts were in place even before the sequester, and they were adjusted for inflation. But then, to add insult to injury, the first of this month, sequestration triggered an estimated 5.3% cut, resulting in a cut of approximately $7.5 billion from labor, health, and education programs. These cuts, and those across all of the other government agencies and programs that provide jobs and needed services, were the reason that we said that the sequester ought to have been stopped, and why we still insist it needs to be repealed. Then there's a continuing resolution for the balance of 2013. Would it end the sequester even for this year? No, it won't. In the health, the House bill would cut $75 million to state health access grants and $276 million to flu funding, among other important programs. Further, the CR underfunds priorities that are critical to crack down on fraud in health care and Social Security and help working families. It does not include a requested $949 million to implement the health insurance exchanges. Their CR does not include a requested $567 million increase for health care fraud and abuse control and for Social Security disability reviews and SSI eligibility determinations. And if these cuts and omissions were not bad enough, the continuing resolution, the Republican continuing resolution that was passed in the House, does not include $35 million in emergency ADAP funding, or $10 million for the Part C medical clinics that President Obama announced would happen on World AIDS Day in 2011. While all of the cuts to health programs are problematic, these cuts are especially devastating because ADAP and the Part C medical clinics are there for financially and medically needy populations that need their service. So are those all of the cuts Republicans are proposing? No, they're not. They are proposing to pass a budget for fiscal year 2014, and the Republican budget would take the cuts in health programs that are already hurting many of our fellow Americans even further. It would cut $810 billion from the Medicaid program over the next 10 years and make it a block grant, which, as we heard in testimony at today's hearing at the Health Subcommittee, would jeopardize health care for children, the disabled, the elderly, and the poor, the most vulnerable in our country. It would raise the Medicare eligibility age and turn it into a voucher for future beneficiaries, shifting costs as much as $6,000 per year to those beneficiaries. And it would repeal all of the funding, as Mr. Horsford said, needed to implement health care reform, essentially repealing the Affordable Care Law and repealing insurance for over 27 million Americans. That is a heartless budget. Its values do not represent the values on which this country was founded, and certainly not those of a nation under God. The Democratic alternative is a far better budget for our country. It ends the sequester, it funds the Affordable Care Act, it raises revenue and makes sensible cuts that spare safety net programs that, given the recession that the Republicans have put us in, are more needed than ever. And it includes a doc fix, which stops the deep cuts to physicians' payments under Medicare, which would have reduced access to care for the beneficiaries. The Democratic budget is a good budget, but the Congressional Black Caucus pro-growth, pro-people, pro-America budget goes even further and builds on the Democratic budget, which has also adopted some of our key provisions. The CBC budget doubles the revenue, as well as increases the investment, as you've heard, in health, in education, in job creation, in housing, in infrastructure programs. It does all of this and still significantly reduces the deficit. And it protects Social Security, Medicare, and Medicaid, and all of the safety net programs. It, too, begins with ending the sequester and funding the Affordable Care Act. I'm really proud of the Congressional Black Caucus budget this year, as I am every year, and commend Congressman Bobby Scott and his team for another job well done. This body and the other must reject the Ryan Republican budget. Everyone can and should support and vote for the Congressional Black Caucus budget, but I'll tell you, it would be far better to pass any one of the Democratic alternatives. They are all better for our country today and better for our future. And with that, I'd yield back the balance of my time. I'll yield back my time.
Thank you, Congresswoman.